One sentence to summarise map of medicine, please.
It's a tool which is a good educational tool, and it's a guidance for all of us, not just for GPs but for AMPs and other primary care physicians who are involved in referring. And the one-liner would be improving patient care for Barnsley patients.
So, apart from improving patient care, why exactly did the CCG feel it was going to help us as GPs?
I think CCG felt that it was a great tool to be adapted in Barnsley, primarily because it would reduce the variation of referral process across the borough, because it's the pathway, if it is followed by everybody, it would reduce the variation. The overall, in the economy we are in at the moment, the overall aim is to reduce the volume of the referrals, because the last couple of years there has been a huge increase in the number of referrals made to secondary care. We're not saying we shouldn't be referring patients, but what we are saying is looking at increasing the efficacy with which we make referrals, hence make more appropriate referrals. As well as, I think there are lots of advantages with map of medicine for the patient as well, because it can be, you can actually operate and use a map of medicine with the patient on board, so really it's a better experience for the patient. Patient is more informed, they're more aware of the journey as they go along, and hence, obviously you're also improving the patient care then, indirectly.
It certainly is intended from a commissioning point of view to give us a real opportunity to share the pathways and investigate the pathways, and also gives us an opportunity for the patients to be involved in some of those early decision making, so which is a key for us to improving the patient's experience of the whole journey.
How many pathways have you got ready for us to use?
At the moment, there are 42 pathways that will be coming live at the end of October.
Okay, and we're doing cardiovascular today, so what pathways are there related to cardiovascular medicine? And I've got palpitation ones up. Anything else?
Yeah, there's AF, atrial fibrillation, there's heart failure, there's chest pain, which is your stable angina and stable angina. And I'm sure there's a CVD.
Okay, so is there going to be any training for us, or is it going to be, anybody can do it, you think?
We are working to roll out a training for everyone who is going to be able and wishes to use that. I have to say that some people who have had a look at this already, and the early adopters, have said that training is not really required too much. It's a relatively intuitive way of actually making the system work. The pathways are fairly straightforward to look at, so the level of training is something that we'll work with the early adopter practices to see how much is required and how much isn't required, and then we'll be rolling that out across through November, end of October.
Are we going to need a password to be able to access them, or can you just use a smart card?
This is to be accessed with a password. When we roll it out to practices, we ask the practice to complete a spreadsheet of the people who are going to use that, and Map of Medicine will allocate a password for that individual.
So will it be one password for our session, not a password every time we use a map?
No, it's a password for the session. So.
Okay, and then all the Barnsley GPs going to have to use it all at once, or are you going to do it bit by bit, days or something you say?
And hoping to roll out batches of 6 practices then, just so we give that technical support.
Yes, from a personal point of view, I'd rather everybody didn't go live all at the same time. That would be an anxious moment, frankly. So we are hoping to roll it out in batches. If people particularly wish to be early on, then we'll try and accommodate whoever wishes to be.
And you know how with the MRI imaging, brain imaging, there was a deadline after which we have to use it. Is there going to be something like that enforced by the CCG that by this deadline all the practices have to be using Map of Medicine?
We are aiming that this is rolled out to everybody by the end of November. Everybody will have potentially access to it by the end of October. It will be there, but people won't have necessarily had an opportunity to have the training and have those logins. By the end of November, we are aiming to have completed that. Everybody can then use that. This is about providing a tool and an educational opportunity in the consultation. It's not about saying this is the way that consultations have to be done. This is an opportunity for doing things.
So that takes me to my next question, and be absolutely honest. Are there going to be any carrots or sticks associated with using it or not using it?
No, I think is the answer to that. No, I mean, it's an opportunity for people to engage in working with us to develop the pathways in the future. We shall certainly look at this from a commissioning point of view and identify particular pathways that people, practices are saying to us, that's not how we'd like it to be, or it's not really working very well, and that gives us a really good opportunity to get good rationalised pathways in place that work for the people in Barnsley, represent what actually happens in Barnsley, and we can do that. We will be looking to do that in prioritised batches.
Okay, so no carrots, no sticks. So if other CCGs have already used map of medicine, again, be completely honest, have there been any problems, or what benefits have you found? Both sides of the piece I'd like to know about quickly.
Map of medicine has been available as something for CCGs and PCTs indeed to roll out for quite a long time, and in that regard we're coming to it relatively late, so we've had an opportunity to pick up any learning from previous developments and rollouts. So I'm not expecting there to be any issues. Other CCGs have found some really significant benefits in terms of reduced referrals and in real cash terms as to the effect of actually using this. Some of that will be because of that opportunity to look at the pathways in a really clear fashion. Some of that will just be that we actually start to make some better decisions.
Well, I just want to say that we're just at the beginning of our journey. We've started with 42 clinical pathways, but we can add as many as we want as we move along. So with the changes in NHS and in primary care especially, when new service design comes up, that will be our opportunity to draw new pathways and inculcate it in medicine really. There are no carrots or sticks attached to it, but I think it's a great tool because when we've actually engaged with some of the practices, it's been a great hit amongst AMPs because it's just a step-by-step guide for them. So.
My last question is, I was wondering, is there any way once these pathways are localised for Barnsley, whether we can put them on the best website under local guidelines? Because the problem I see sometimes with a patient with me, there's a lot of stuff to read. If I want to become familiar with a pathway, I'm more likely to use it. If it's on the best website, then say for my revalidation, appraisal, whatever, I can say, right, I'm going to look at 3 pathways, become familiar with them, and then not only will it help me with that side, but then I'm more likely to use it. Is that a possibility?
We are looking at that, and I think we would like to use BEST as our brand and inculcate map of medicine eventually onto it.
Lovely, thank you. One question?
I'm sorry, excuse me, slightly, but these map of medicine available to someone will this be incorporated into that?
Well, what we have as map of medicine on System 1 is just the national pathways. These are the pathways we've worked on locally, and we have localized them. So obviously, what you will get on your toolbar once this goes live is a username and password, which will be very much localized pathways. So what you're able to see at the moment is what's sort of national.
Will you still be one click from System 1?
Absolutely, yes, absolutely, yes, yeah.
That's the one advantage you can have of doing this. Is you can go from
Yep. Map of medicine, yeah.
Right, thank you very much. I think we'll move on to the next part. So the next part